Hello, everyone, and welcome back to another episode of Arthritis at Home. Today, truth and reconciliation. What does that mean, and what is happening in the arthritis community in Canada? One of the most important calls to action by the Truth and Reconciliation Commission is recommendation number 22 as it relates to traditional healing practices. And I quote, "We call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients." Today, federal, provincial, and territorial governments are working together with Indigenous peoples, community leaders, and working on the development and implementation of culturally appropriate and Indigenous designed programs and services to improve Indigenous healing, health, and wellness. To talk about it in the arthritis context and what ACE is doing to help lead the arthritis community in Canada on its pathway towards truth and reconciliation, I'm joined by Ellen Wang, who is ACE's program coordinator. Ellen, welcome.
Thank you for having me, Kelly.
Let's get started maybe just first with a little background, Ellen. I did say that ACE is helping lead the community across Canada on this path towards truth and reconciliation. Maybe you can just, first of all, introduce some of the work that we're doing along with other community members currently.
Absolutely. So arthritis consumer experts, even before I joined as the programs coordinator, had already initiated their work on truth and reconciliation. And it all started in the form of an arthritis circle where we had individuals who represented different, whether that was patient advocacy organizations, research organizations, fundraising organizations, all of these individuals who, had a very prominent voice in the arthritis community came together to not only learn about what is truth and reconciliation, but to do the self-reflection piece that is so critical. And from that really stemmed then multiple different initiatives, one being this webinar series that we've put on, starting from 2022. We had about 4 webinars last year, and this upcoming webinar will be our first of 2023. This is just one of the initiatives that we're taking. There will be a website that's launching. There's a retreat happening. So really, we encourage everyone to keep your eyes and your ears out to learn more and to engage.
So you mentioned the upcoming webinar, and it's going to look at Indigenous healing practices. If people have heard about these practices, not too sure what they are, or if this is the first time they're being introduced to it, can you just tell us, before we get into the webinar, just tell us a little bit about what are these healing practices and what is their importance?
Thank you, Kelly. This is a really fantastic question, and I'm probably not the right person to answer it. That said, I do encourage everyone to come to the webinar to actually learn from an Indigenous scholar who can speak from her first person's perspective about someone who not only shares these with other Indigenous peoples, but also practices them herself. So from our work at ACE, as we work towards addressing call to action number 22, as you had specified, Kelly, we're calling others to action, that is us, individuals who are non-Indigenous, who are part of the existing healthcare system, for us to learn about these Indigenous healthcare practices, whether that's, for example, smudging, certain different types of ceremonies, and the importance of them in not only the healing or the physiology from what we as Western people who practice Western medicine, right? Our medicines, our treatments need to be proved using numbers, but these are truly, we call them practices because they encompass not only medicines, but processes and ceremonies that really address a holistic view of health that many Indigenous people hold and many Indigenous people live, that holistic view. And again, the importance really being to, it is deep rooted in the culture and deep rooted in the history of Indigenous peoples to practice these.
So it really is all about education for us as settlers. And for our audience, they've often heard ACE and ACE representatives talk about arthritis models of care. These really, for all intents and purposes, are Indigenous peoples' models of care. And the goal is to somehow find a harmony between the two to ensure that Indigenous peoples across Canada are getting the best possible arthritis care. So it's an interesting, I think, fusion of mainstream traditional thinking. And I guess what maybe we turn our attention now to the actual webinar. You mentioned that we have a special guest. What can people look forward to with the webinar that I think is coming up? Confirm with me. I think it's May 26th, Ellen. What can people expect?
Exactly, Kelly. May 26th, we highly recommend that everyone sign up as soon as possible. It'll be taking place at 9 a.m. Pacific time or 12 p.m. Eastern time. And our Indigenous scholar, Dr. Terry Lynn Fox, will be back to share, again, her perspective and her own practice and how she incorporates and how she uses these healing practices with others in her community. And Dr. Terry Lynn Fox, I think, as you said, Kelly, really is able to reach and touch her audience, which is us, the Western medicine practice, people who practice Western medicine, because she's not only Indigenous herself. So Dr. Terry Lynn Fox is part of the Blackfoot Confederacy, but she also has her master's degree in sociology and her doctorate degree in education. So she brings that scholarly lens and is able to then allow us to see what is the benefit from the, as you said, meshing of the two worlds, and how can we use this to truly improve those models of care that do exist, so that we can incorporate, a little bit of the Western medicine that we know is evidence-based, but also the Indigenous healing practices that have thousands and thousands of years, right, of anecdotal evidence to really create a holistic approach.
We're extremely fortunate to be working alongside Dr. Fox as we are embarking, all of us, at different speeds and different times on this this journey to truth and reconciliation. And certainly from, as you mentioned, we had previous, I guess, 4 webinars in 2022. They all got a really, really high rating in terms of their people understanding them, the value of the education that they received, and a lot of great comments about Dr. Fox and her participation and leadership. So we're extremely grateful that she's continuing to work alongside with us. So if people want to register for the webinar, want to attend, do we have some information for them? And then also, are they able to get further information if they attend that webinar? And are they also going to be able to participate in any sort of Q&A or dialogue during the webinar?
Absolutely, Kelly. Great question. So we will link the registration right underneath this video that is posted. It will also be plastered over social media. So hopefully everyone will be able to see it that way. There will be a recording of it. So if you aren't able to make it that way, you can on your own time, learn, and then share with your own community and maybe pass it on to someone else who you think could benefit. And absolutely. So what will happen is it's about a 45-minute webinar or didactic, what we call a didactic teaching session coming from Dr. Fox. And then we have about 15 minutes of Q&A. From there, we will take all of the resources that Dr. Fox has shared with us, any of the questions or inquiries that we receive, and we will send out a follow-up email to everyone who signs up. So even if you can't come, please sign up so that we have your email and we can then send you a list of resources, a list of websites, a list of readings, whatever those are, for you to deepen your own knowledge and to really, learn and then apply.
May 26th, 9 o'clock a.m. Vancouver time.
You got that?
We really hope our audience, viewers today, will be able to join us, share this information, share this invitation with members in your network, in your community, for us to get stronger and for us to make more progress on this path to truth and reconciliation. It really requires all of us to get involved and all of us to participate. So join our circle, and we please hope you can attend. Ellen, thanks so much for joining us today. I do believe you're the moderator of that webinar. So it was really good to get all of this information firsthand from you. Thanks for helping us understand what we're trying to do in 2 Fridays. And to all of you watching, thanks for joining us today. And we look forward to seeing you again on Arthritis at Home. Thanks, Ellen.
Thank you, everyone.